I'm Dr. Dan Carothers. I'm an adult and pediatric otolaryngologist in Atlanta, Georgia. I work at the ENT Institute, and I am a rhinologist, which means I focus primarily on nasal and sinus disorders, although I do treat all aspects of general ENT. And, a lot of times people wonder, what does an ENT do? Why would I go into an ENT office? A lot of times they haven't been to an ENT maybe when they were 4 to 6 years old when they had their tonsils out. But I can tell you it's usually not for a social visit. There's usually some sort of problem they're trying to solve, and frequently that problem is related to the nose and sinuses. About 50% of people have some issue taken together with their nose and sinuses, whether it's nasal congestion, stuffiness, sore throat, headaches, facial pressure, that sort of thing. Very common issue. And, in order to kind of figure out what's going on, there's a few things that are critical. And getting a good history, what is the story? How long has this been going on and such, is really important. A lot of times, my dad's a physician. He is practiced until last year. He's 83, and he would say that 80% of the time you can find out the answer just by talking to the patient, which I believe wholeheartedly. So it's really important to listen. When it comes down to solving this problem for patients, I think there's three things that we're looking at besides the history. The first is, what is the anatomy look like? And knowing what the anatomy looks like is critical, because frequently it's a structural problem. Right there, you can look inside the nose and you can see that the wall that divides the nose into two sides is leaning to one side. We call it a septal deviation. It can be straight on one side and a bone spur blocking the other, or it can literally be just, leaning to one side and then that side just doesn't get much airflow. So looking inside the nose and then using what's called a nasal endoscope, which is a small, flexible or rigid, essentially camera that can look up past the nostril, and you can identify whether or not there's blockage to the sinus openings by nasal polyps. You can see whether the structures called turbinates are enlarged. That is common in problem, maybe one of the most common problems that exists. Looking further back, you can see whether the back of the nose, the nasopharynx, has adenoid tissue that's obstructing. Sometimes there's benign and malignant growths. So doing a good exam, nasal endoscopy is critical. That really sets the stage for a treatment plan. And the next thing that we like to do is an allergy test. And, some people might say, why would you do an allergy test? Just go to the over-the-counter aisle and pick up some Allegra, pick up some Benadryl, Flonase, something like that. And not that it doesn't work. It just doesn't really give you the information you're looking for. And you can go your whole life. I mean, I see patients who are, 40, 50, 60 years old, and you've never actually had an allergy test. So you're taking this medicine and you don't even know if you have this problem. I mean, what other medical condition is there where you don't even know if you have it, but you're just popping pills from the over-the-counter aisle? So the benefit of an allergy test is to help you understand, do you have allergies or not? Allergies are actually less common than you think. Only about 30% of people have allergies. And so 2/3 of people who are just getting medicine from the over-the-counter aisle will get no benefit from it. So get an allergy test. That can be done through a skin test, which is how we do it, or you can do a blood test. They both are effective ways to find out if you have allergies. And based on that, what you're allergic to tells you when your allergies are, which is a really useful thing. So if you have terrible congestion and sneezing and nasal symptoms in the spring, that green pollen, that's from the trees. And the allergy seasons last about a month or two, 6 weeks, something like that. If it's grasses, that's more of a midsummer, and if it's weeds, it's more of the end of the year in the fall. And so those are the seasons. And depending on what allergy season you're allergic to, you could focus on taking medicine. If you're allergic to all the seasons, which is sometimes the case, then you'll be on allergy medicine all year round. Otherwise, allergy testing can be used to determine whether or not you'd benefit from a non-medical medicine treatment called allergy immunotherapy or allergy shots, which 90% of people respond to. Allergy shots do work well. It can be considered an alternate or an addition to what you're taking for allergies. We offer a home-based allergy shot program that's frequently covered by insurance, and that can be a great way for someone who's looking not to be on medicine or just hasn't really gotten much success with the over-the-counter medications. In addition to allergy testing, it's important to have a CT scan. So a CT scan is essentially fine-cut X-ray pictures in an orientation that's front to back, side to side, top to bottom, in which you can see the sinuses and whether the sinuses are filled with air or whether they have fluid or polyps or swelling. Also, you can see the size of the sinus openings. Based on a CT scan, the exam with the nasal endoscope, and an allergy test, you really can come to the answer to find the solution in most patients. There are sort of outliers where it's a little more difficult, and certainly every field of medicine has those. But I would say the vast majority of people with those three things can get a treatment plan that's highly effective. In terms of solving this, if you have a sinus infection, obviously antibiotics are in order. And in some people, you might need two different antibiotics. Once the bacterial infection is gone, the inflammation in the sinuses can be treated with either oral or topical steroids. A lot of times that is successful. I would say, when you altogether, you're looking at a fair success rate with a combination of antibiotics, steroids, and allergy medicine. But there's a good percentage of people, I would say, 15% of people or so, after a sinus infection, some sinus infection in the past, or just as a result of structural narrowness inside the nose where the sinus openings are, you're going to have an infection or inflammation that just lingers. And this issue, which we call chronic sinusitis, is frequently better treated with surgery than continuing medicine. In fact, the indication for surgery is failure of medical management, which is generally a few months of the above, what we've talked about, antibiotics and steroids and topical steroids and antihistamines and saline rinses, etc. When you're looking to treat the sinuses with a procedure, I think an approach to do the less invasive procedure first, if it's an option, is preferred. And I think a lot of ENTs, including myself, look at non-invasive dilation of the sinus openings, which we would call balloon sinuplasty, to be a great way to eliminate, reduce, improve sinus problems. It can be done as long as the septum is not severely deviated. I don't think it works great in those cases, but in a lot of patients, a little deviation of the septum is really not, doesn't have to be corrected. You can improve the breathing by simply reducing the turbinate size in the office in addition to dilating the sinus openings. The natural sinus openings are a size that generally works well. So 85% of people don't have a problem. The mucus is produced in the sinus. It drains out of the opening. That flow out is sort of like a flushing toilet. Let's say you have toilets in your home, as long as they're flushing and everything's going great, you won't have sinus issues. But when it backs up, let's say you get a hairball in the sink, you end up with mucus that sticks around. You have inflammation. The sinuses don't drain all the mucus that's produced, and you can have recurring infections. You can have chronic infections. The natural sinus opening is about 1.5 millimeters or so, 2 millimeters. And in the office setting, or, if you need to go to the operating room, you can dilate the sinus openings to about 7 millimeters, which is about 10 times more able to drain and exchange airflow. So oxygen can get in there and reduce certain types of bacteria that function in low oxygen levels, called anaerobic bacteria. These bacteria are the bacteria that cause bad breath. And, you can have morning breath and you can have morning sinuses. So If you allow anaerobic bacteria to overgrow in the sinuses, it becomes unhealthy, creates inflammation, and then your sinuses fail to drain, and it becomes a chronic recurring issue. So balloon sinuplasty is a very useful treatment. I think that that's my go-to for milder types of sinus problems that don't have polyps or fungus debris, where the septum is not severely deviated. This is a procedure that's done in an office setting. It doesn't require much anesthesia, maybe some Valium and a little bit of pain medicine just to take the edge off, be a little sleepy for the procedure. It helps. Usually it's done in less than an hour, maybe 30 minutes of the procedure. You're just numbing the opening right where the balloon will go. And then the other 30 minutes is getting the balloon in a deflated state that to span the opening from inside of the sinus to the nose. So imagine half of the long, thin balloon is in the sinus and half is in the nose, and you fill it with water and it spreads open the sinus, cracking the bones into a new position. They're very thin bones. You might hear a little crackling as the balloon is dilating and opening the sinuses, and then you deflate the balloon and just simply slide it out and do any other sinuses that are there. There can be 6 sinuses done with the balloon. Balloon sinuplasty has been around for a long time. I was part of the original training of the country for people in balloon sinuplasty. When I was at Northwestern, I did my first balloon sinuplasty on a cadaver in about 2004 or 5, something like that. Back in the day, we had to use a C-arm X-ray. I even had a special glove, so I would stop seeing my finger bones when I would do the C-arm. That sort of went away, and these small light wires were developed. This technology has come a long way, and it's relatively easy, simple in some cases, to do a balloon in the office. In cases where balloon sinuplasty is not going to work, let's say your septal deviation is too severe, it's too much of the problem, there's nasal polyps, there's fungus debris, etc. Traditional, minimally invasive endoscopic sinus surgery can be performed. That is truly the gold standard, I would say. If a balloon sinuplasty doesn't work, then the next procedure would be endoscopic sinus surgery. So in that way, I would say that minimally invasive endoscopic sinus surgery is sort of the end-all be-all of sinus surgery, but it's a little more recovery, it's more effort, it's a little more discomfort. The pain score from balloon sinuplasty, if 10 is the worst, is about a 2 or 3. I even will tell patients that during the procedure it's essentially painless. Whereas traditional endoscopic sinus surgery is not very painful. I would say 6 to 9 hours after the surgery, you might have a pain on a scale of a 5 to 7, something like that, requiring pain medication. So that minimally invasive endoscopic sinus surgery, you're able to correct deviated septums, get the septum nice and straight, do a turbinate reduction, which improves the breathing of both sides. Sometimes if you have a septal deviation that's severe to one side, when you bring the septum to the middle, you've actually made the other side more congested if you don't deal with the turbinates. And therefore, submucous resection is done. What does that mean? Well, you're not actually removing the turbinates or cutting it out, or, everyone who has looked into this would have heard of something called empty nose syndrome, which is sort of a relic of the past. Old techniques where you would actually, with a scissors, remove some or part of or even all of the turbinate. It sort of made sense at the time, way back 20, 30 years ago, but a submucous resection leaves the turbinate completely intact. It just shrinks it from the inside. I will describe it similar to a liposuction. So you place a 2 millimeter suction inside the turbinate. It removes some of the inside of the turbinate. Obviously, it's not adipose tissue or fat, but it is a tissue that can be suctioned out. And then it shrinks up almost like a grape would be shrunk by removing some grape juice. So having a straight septum and turbinates that are reduced gives you that feeling that you're decongested. Maybe you felt great after you've been on a jog. You can breathe perfectly well. Man, I wish I could breathe like this all the time. That's the type of improvement that you would get from a septoplasty and turbinate reduction. During the endoscopic sinus surgery part, there are small endoscope, a 4 millimeter telescope that's broadcasting to a TV in 4K HD. You're looking at the nose and sinuses, and the sinus openings can be widened. And instead of thinking of balloon sinuplasty as cracking a door to a room open ever so slightly more, endoscopic sinus surgery would be like if you took the hinges off the door and just removed the door. So you have a much bigger opening than you can achieve with endoscopic sinus surgery. Instead of it being 7 millimeters, we're talking in 2 centimeters or so, maybe the size of a nickel or something like that. Having a sinus that is open to that degree allows debris to be removed. You can have fungus debris or polyps, mucus that has become thickened or inspissated. You would suction that out. The sinuses are opened, connected together so that you have less overall sinuses. The sinus between your eye, called the ethmoid sinus, has about 8 to 12 individual spaces sitting front to back, sort of like miniature Cadbury eggs or something like that. And the intervening spaces between the ethmoid air cells can be removed. The honeycomb is removed so that there is just one sinus. So endoscopic sinus surgery can have the result where the sinuses that have one opening have a larger opening, and things from within the sinus can be removed. And then you have overall fewer sinuses. The ethmoid sinus, instead of having 8 to 10 spaces, has one space, all of which then allows it to drain much better into the nose. And once the procedure is done, there's like a period of about 24 hours after the surgery where you'll feel congested. There will be a recovery day, maybe some pain medicine during that day. And then in the first week, it kind of feels like cold-like symptoms. After both procedures, balloon sinuplasty and endoscopic sinus surgery, you're looking at about a week where you're almost a little worse at first. And then once that week is over, you see a dramatic improvement at the end of the first week. And then that improvement continues over the next ensuing several weeks. And, when people come in to find out what their problem is, they're looking for a solution. That can be the end result. And in many patients, we're able to pretty quickly figure out what's going on and take care of it, and then they can be on their way. And that's one of the beauties of ENT, is that you can find out some medical problem, find a solution, fix it, and then they're on their way. And it's very rewarding from a surgeon standpoint to be able to do that, because being able to breathe through your nose and have good functioning sinuses is so helpful during exercise and just breathing in general, sleep. Overall, your ability to concentrate and focus can be much better. And I think that's one of the reasons why I've chosen to focus on rhinology, because it's sort of, in a way, fun, to treat patients and fix problems and see the results. And, it's like, honestly, see smiling faces, it's great. Well, to wrap it up, this is Dr. Dan Carothers at the ENT Institute. I hope that wasn't too much detail. I wanted to kind of give you a rundown of what it's like, why would someone see an ENT, and what we might talk about, and what we might put together in terms of a treatment plan, and hopefully result in some great improvement as we frequently are able to achieve.